everybody, so I wanted to share my new protocol with you from the Care Oncology Clinic in London, based on the book How to Starve Cancer by Jane McClelland. I think that's pronounced correctly. My brain tumour, I struggle with speech. So I'm actually in direct contact with Jane at the moment, and we're planning an interview when she gets back from Lithuania in March. So we're going to be able to bring you much more information about her book, How to Starve Cancer. And we're also going to be able to bring you information direct from the horse's mouth as such, because she's going to be helping. So these are the medicines that I've got from Spain. I've got them over the counter because it's legal to buy over the counter medicines in Spain. My doctor in the UK did not want to prescribe me anything for obvious reasons. So I'm aware that I believe in Scotland and other places there are some online pharmacies you could buy things. So this is what I've got, and obviously in America it differentiates as well. So we've got the statins, we've got this should be the mebendazole. We've got the metformin, 1,000 milligrams from Spain. I do believe that's the same. Yeah, that's the same as that one. I've also got a different box of that. And these metformin tablets I was given by family who don't use as much as they need. So we're going to start on the 500 milligram dose rather than splitting these tablets. So these are more applicable to me, and I've got them from people. So what I'm doing for my brain tumour, which is my oligodendroglioma, astrocytoma, with the IP1Q deletion as well, genetics of my tumour. So I'm going to be taking for my brain tumour 2 of these a day, one in the after breakfast and one after supper. Now apparently they do cause a bad belly. Now most of us have bad bellies anyway, so that's nothing new. However, sometimes they say work up to it. For me, you know what, a bad belly is a bad belly. I'm just going to go for it. The mebendazole, I'm taking 100 milligrams every day. There's only 6 of these in a packet, so I'm going to order more. And then I'm going to switch to an antibiotic to 4 weeks. And we're now reading the book and finding out more from Jane and the Care Oncology Clinic patients and them on how and why we do this. But you have to keep the tumour guessing. You have to keep it on its toes because it will keep changing its energy pathways as well. The statins. And then Mum's also added in a vitamin D spray for me because it seemed a higher concentration in the spray. I've got my CBD, which I'm going to be doing some more videos on because a lot of people are asking me about doses of this. I'm going to do some videos on the THC as well. Serapeptase is the tablet that will eat all the dead cancer cells in my brain to stop them from being used to feed the cancer. Aspirin, you can get that anywhere. Now aspirin's good for all cancers, I do hear. However, I'm actually allergic to this. So I'm going to start on a very small dose with my inhaler and my EpiPen in my hand with Mum, probably outside the hospital just to see how I get on because it's part of the protocol. I can't admit anything. However, I've not tried it since I was a kid, so hopefully it'll be okay. Mum, what's in the golden paste, please?
Turmeric, black pepper, MCT oil.
Turmeric, black pepper and MCT oil. Because to absorb the turmeric, I'd realise it needs to be taken with black pepper, and the MCT oil is really good for crossing the blood-brain barrier too, so that's why she's added this in. Berberine, I'm getting some more information about that. SEIT, I'm getting some more information about that. It's just arrived. I'm going to do 1 coffee enema per week. Obviously, I'm not going to show you how to do that because it's disgusting. However, I will be putting up the protocol for that on how to do them at home. And I do not know what these are. My mum's getting these ordered for me at the moment, and then this is going to be my complete protocol every day to replace the THC and the CBD, which is still in it, but to replace the Panicure, this is going to replace the mebendazole. So what these drugs are hoping to do is inhibit cell growth of my tumour. So I'm hoping these are going to stop the tumour growing. They're going to stop its energy pathways from the fats and glucose, which feed tumours. Obviously, sugars feed tumours. So what we're going to do is we're going to block the glucose from getting to the tumour, which I hope it's going to die and then get killed off by these and then get eaten off by these. This is the theory. So we're going to stop the cancer growth, I hope, because it's trying to act very aggressively right now. I have my next MRI booked for April and my results beginning of May, which seems forever away when they've told me that the cancer is very active and we're pushing to bring those forward. And the metformin also crosses the blood-brain barrier a lot better than fenbendazole apparently, which is why you take oil with the fenben. So this is the Care Oncology Clinic in London for a brain tumour astrocytoma patient. I'm not sure of the clinic's protocols for other cancer. However, these repurposed drugs are what they're focusing on, following the How to Starve Cancer book from Jane. So we're going to be getting more information from her. I'm in discussion with her at the moment, so I can ask questions if needs be. And I'm also going to be interviewing her, and then I'm going to be interviewing in the coming weeks Scott Davis as well, who he's now stable thanks to these things. And he was following the fenbendazole. You might have seen his story in the press for his inoperable, untreatable colon cancer, because the cancer was wrapped around his colon, so it was obviously inoperable. And he's been taking these, and he has a PET scan this week. So I'll be able to give you more upcoming information about Scott as well. And I've just kept the video on this so you can make notes, take pictures, write it down, and so on. Any questions, obviously do consult the book, How to Starve Cancer, and also the COC, the Care Oncology Clinic in London. Thank you all for your kind words, guys. I'm so pleased that I've got this next step, because obviously the devastating diagnosis that my cancer is starting to get active again after finally stabilising it after 7 years was heart-wrenching, and it's caused a lot of depression and anxieties and a lot of upset of our family and friends. And I hope that it doesn't reduce hope in the alternative treatments, because I am a guinea pig. We're all guinea pigs. We're all doctors. We're all taking our life into our own hands here with the best knowledge that we have. And I really want to say thank you on my YouTube for everyone who comments, because you guys are a wealth of knowledge. You know way more than me, most of you. And I really, really appreciate that when I educate everyone on my story, you are there to educate even more on all of these things as well. So feel free to throw in any snippets of information, because you guys are the best. Thank you, and I'll be coming back to you with some more information on this soon. Bye.